How are you doing today?
Doing all right. How about yourself?
Pretty good. My name's Ben Olson. I'm going to be your PA today.
Nice to meet you.
Can I
Gabby
get
Roberts.
your name and date of birth?
Gabby Roberts, April 3rd, 1994.
Wash my hands real quick. What brings you in to see us today?
Well, I just got referred here from my general practitioner, and he said I need an abdominal checkup, so here I am.
Okay. I'll take care of that for you. I'm just going to go ahead and get your, listen to your lungs and heart real quick.
Okay.
And go ahead and take a deep breath for me. In out. In and out. In and out. One more. In and out. In and out. One more. Sounds good. I'm just gonna listen to your heart. You can just go ahead and breathe normally. It sounds good there.
That's good to hear.
Huh?
That's good to hear.
Yeah. If you can go ahead and lie down for me
Okay.
and get comfortable. You feel comfortable?
Yeah, pretty good.
Just keep your hands by your side. So we don't have any gowns today, but I'm going to ask you if you could expose your abdomen up to the nipple line
Okay.
and your pants down to about the top of your hips.
Okay.
Okay. So here I'm just going to inspect for symmetry. Abdomen looks symmetrical. I don't see any abnormalities such as skin lesions, rashes, or bruises. There is a scar here from what's the scar from?
Fell off a bike.
Fell off a bike. Okay. The umbilicus is not inflamed, and I don't see any bulges. Could you go ahead and cough for me? Okay. No signs of any hernias. I don't see any dilated vessels or anything like that. No peristalsis, and I do not see any aortic pulsations. I'm going to go ahead and auscultate. I'm just going to listen in all four quadrants. Normal bowel sounds, clinks and gurgles. Everything sounds good there. And I'm gonna go ahead and listen to your liver for any friction rubs or venous hums.
Okay.
Good. Go ahead and just breathe in for me. And out. Okay. I'm gonna listen to your spleen as well.
Okay.
Everything sounds good there. I'm gonna go and listen to your aorta,
Mhm.
and then your renal arteries and your iliac arteries. Okay. Everything sounds good. I would go ahead and listen to the femoral arteries if we had a gown, but unfortunately we do not. So we will forego that for now. Now I am going to percuss, and I'm going to strike the distal interphalangeal joint of my non-dominant hand with my middle finger slightly flexed in all 4 quadrants. Typically you're going to hear tympany. I'm just going to start in your right lower quadrant. Everything sounds good there. Now I'm going to approximate the size of your liver. I'm going to start from an area of tympany along the right mid-clavicular line. And what I'm going to do is start where there's tympany and work my way up until I hear dullness, which would be the inferior border of the liver. About right here. And then if you could lift your shirt above your nipple line so I could start from the top. About here. And then I would measure the size of the liver. It appears to be within normal limits. And then I'm going to percuss for the spleen. Over here. What I'm listening for is any signs of dullness. I'm going to have the patient take in a deep breath for me while percussing and exhale. Listening for any shifts from tympany to dullness. I did not hear any dullness, so that means that the spleen is within normal limits. Any signs of dullness could lead to splenomegaly and should raise concerns. Now I'm going to move to light palpation. Okay, if I could ask you to bend your knees for me, just keep your hands at your sides. I'm just going to go lightly around. I'm looking for any superficial masses or guarding, or rigidity, or tenderness. So let me know if anywhere is tender. Good. Okay, now I'm going to do some deeper palpation. Let me know again if anything elicits any pain or tenderness. I start in the right lower quadrant, looking for any masses, tenderness. Everything feel good?
Yeah, feels good.
Okay. Now I'm going to palpate for the liver. I'm going to brace the patient. Ask the patient to breathe in. And exhale. Okay. The liver appears soft, well demarcated, sharp borders, no signs of any nodules or bluntness. And then I'm going to palpate for the spleen. If you could go ahead and take in a deep breath for me. And exhale. Okay, good. I did not feel the spleen, but that is normal. If the spleen was enlarged, you may be able to feel it and should raise some concerns there. Now I'm going to do a test for peritonitis. It's called rebound tenderness. I'm going to slowly palpate deep, and I'm going to release fast. Let me know what elicits more pain.
Okay. Pushing in.
Pushing in, okay. And then I'm going to move on to a test for appendicitis by the Robson sign. I'm going to push in, palpate over here. Let me know where you feel pain, okay?
Didn't feel it anywhere.
Okay. Typically with a positive Robson sign, they would have referred pain in the right lower quadrant. However, his symptoms are negative, or signs are negative. And then I'm going to ask you to lay flat for me.
Okay.
Okay. I'm going to perform the psoas test by placing my hand slightly above the patient's knee and applying light pressure. Ask the patient to raise his right leg. Does that elicit any pain?
No.
No? Okay. That would be a negative sign. And then if I could ask you to bend your knee and relax. And then I'm going to, this obturator sign, I'm going to internally rotate the hip. Any pain there?
Nope.
No? Be a negative obturator sign. And could you cough for me? Does that elicit any pain?
No, you're good.
Okay, and then lastly I'm going to do the Murphy sign.
Okay.
Palpating under here and asking you to inhale. Watching the patient's face for any grimacing and exhale. Okay. Negative Murphy sign. And then I'm going to palpate for the aorta. And then work my way out so I don't feel any pulsations. The aorta appears within normal limits, under 3 centimeters. And I believe that's all I got. Do you have any questions for me today?
No, I'm good.
All right, thanks for coming in.
Oh, thank you.